Welcome to Community Spotlight. On this show, we love to showcase businesses and entrepreneurs that truly bring value to our communities. And today I am with Dr. Paul Mikailian, optometrist. Paul, thank you for being here.
Thank you so much, Mike. Appreciate
I'm
it.
in your place.
Welcome to our place.
Yeah, thank you, Paul. Well, I have a lot of great questions to ask you because no one really talks about eye care. And I feel like we should bring value to our community. So my first question is, what are some of the common eye conditions you encounter in your practice nowadays?
The main thing, of course, people come in for typically is they see blurry.
Okay.
So there's a lot of things that'll cause that blur. Typically, the main thing is you need glasses. So you're either farsighted, meaning you see distance well, you can't see up close.
Okay.
Or nearsighted, the opposite. So you can see close, you can't see far away. So for those, relatively straightforward, we give them glasses. Another similar condition is astigmatism, where the shape of the eye is not perfectly, let's say, round like a basketball, slightly like the shape of a football. So you have two prescriptions sort of in one.
Okay.
So if there's a piece of light coming into your eye, instead of being like a perfect dot at the back of your eye, it splits sort of into two. So that's typically where you're driving at night and you see like those streaks on the lights. That's a very common condition that patients come in with, and we correct it, either glasses, contacts. Being in Southern California, another big one, of course, is dry eye. So that we have many ways to treat it. We have eye drops.
Okay.
There's these basically plugs we put on your tear ducts, so that'll keep the tears on the surface of your eyes, prevent those from flowing into down your nose and all of that. So those are the main things we tend to see.
Is there an age group that you notice in like most? Like, is it younger kids, older kids, or adults?
With the dryness, honestly, nowadays, it's a lot of people, everyone almost, because of the screen time, actually. When you're on a screen, you just tend to blink a little less. So the longer you keep your eyes open, the tears just lose that stability. You get dryness. So that'll cause a lot of problems, including blur, because the first thing that your light or an image hits when it's going into your eye is actually the tears. So if that's a little disrupted, you're not going to see as clear as you possibly could. So it causes a lot of issues.
So no TikTok for 45 minutes in the evenings.
Exactly. Avoid it. Before bed, don't use TikTok. Don't be on your phone, tablet. Just, it's better for your eyes, better for your sleep, better for your sanity probably too.
So Paul, this question is geared towards the parents, okay? At what age should children have their first eye exam, and how can parents help maintain their children's eye health?
So first one, it's more of like almost a screening, is around 6 months or so, just so we can make sure their eyes are aligned, they're tracking things the way they should. And then we are able to slightly see if they already are developing some type of prescription for glasses. And so
you can find out in the first 6 months.
We can. We can kind of scope a light into their eye, and the way the light bounces back at us, we're able to kind of assess, okay, if there's a prescription that's about to start, whether farsighted, nearsighted, or astigmatism, we can kind of assess at that point. So it's good to get an early start, because if we start early enough for certain prescriptions, we can prevent that from becoming a problem down the road. And same with the eye alignment. That's a key, where if the eyes are misaligned, finding it early, diagnosing it, treating it is key. After that, I would say, if you don't really see as parents or family members as problems coming up for the child, around preschool or kindergarten before they start, you want to get another exam just to make sure that they are able to have good hand-eye coordination if they have a visual problem. That way you can get them glasses if they need. After that, every couple of years, you do want to check, especially before the school year starts, just to make sure that they don't fall behind, because obviously vision is going to be huge for learning. Absolutely. They got to see the board. Nowadays, they got to see the tablet. You don't want them to get headaches. Also, another condition sometimes we see is one eye is perfect, the other eye might be lagging. And then that's something you won't notice until you do an eye exam, and we check each eye individually, because with both eyes open, if one eye is perfect and the other eye isn't, you won't know. And the child won't complain either.
Good to know.
So it's always good to check periodically.
Since you mentioned screen time, which we all do nowadays, with increasing screen time in today's digital age, what advice do you give to patients to protect their eyes?
So limiting screen time obviously is the biggest thing. Ideally for kids, an hour or less a day, which might be impossible with school, but after school at least keep it below an hour a day. For us who are in, working, things like that, if you're in a field where you're on the screen 8 hours a day and you have no choice, you got to try at least every 20 minutes if you can, set a timer, do something where you give your eyes a break, look away from the screen or just kind of step away for a few minutes just to let the focusing system of your eyes relax. So that's probably key. The other one, like you said, we want to avoid too much TikTok. If you can at night before bed.
It's terrible.
Once you're home,
it's terrible.
It is terrible, and we all do it because once you're on it, you're like, let me look at something for 2 minutes.
45 minutes later, you're still on TikTok.
Exactly. So I mean, if you can avoid it, and then for kids to avoid that, give them more outdoor time, just to develop that distance vision, because we are seeing a lot more kids who need glasses after that couple of years at home with COVID and everything. Exactly. They were stuck on screens and they didn't get away from it. Video games, everything else. So
see, we got to make sure we
exactly
limit screen time.
Another one actually is the blue light glasses. A lot of people, for them, it makes a big difference. For those people who are on the screen for 8+ hours a day for work, that gets rid of some of that glare, some of that tired eye feeling that they get by the end of the day. So if you
my blue eye, I haven't heard of that.
So basically, screens, phones, computer, all of those emit a certain wavelength of light, this blue light. So now, maybe for the past 5-10 years, we've had these new blue light glasses. There's actually contact lenses as well that kind of bounce that away from your eye. They, get rid of that glare and then essentially protect your eyes from that harming wavelength of light. So that's another one that's really helpful. Both the contacts and glasses.
Okay.
Have that.
Since you mentioned contact lenses, what are the pros and cons of contact lenses, and how do you help patients choose between glasses or contact lenses?
So the main thing for contacts is typically lifestyle. If you are active, sports, or a job that requires you to be active, firefighter, police officer, I don't know, basketball player, whatever it may be. Obviously, contacts you have to use, although you could use goggles. No one really uses those goggles anymore nowadays, like Kareem. So that's probably the main thing. As far as pros and cons of contacts, there aren't too many cons anymore because of how good the materials are, how breathable they are, and then there's daily disposables where you essentially wear it once, throw it away. So that risk of infection where we had to reuse it, or the inconvenience of having to clean it, put it in the case every night is kind of gone. So honestly, the only con is if you abuse it, if you sleep in them, you overuse them, then the risk of infection's there. Dryness for some people, like we mentioned earlier, might be an issue with comfort, but again, the materials are so good that it's rare nowadays. Like I would say 95+% of patients can wear it. And then glasses, I mean, if you can't see, you need glasses, and if
it is what it is.
Exactly, it is what it is. If you don't want, I mean, you got to see. So, yeah.
Completely off topic, since we were talking about TikTok earlier.
Yes.
I recently saw several videos where people are changing their eye color. They're having some type of a laser treatment or something. They're completely changing their eye color. Eye color is permanent. What's your take on that?
I mean, it's
scary, isn't it?
It's not it's not FDA approved. Obviously, it's an elective thing, and it's pretty risky because they're essentially, like you said, changing the eye color. I've seen some where the pressure, goes up, then they end up getting like glaucoma because of what they're doing. Yeah, it's not. I mean, I haven't had anyone do it. I haven't seen anyone do it, but obviously, I wouldn't recommend that. Just wear colored contacts if you want, your eye color changed. But yeah, I've seen that. It's pretty intense.
You know what it is? Societies, everyone's just changing so fast, and everyone wants to have this specific look. So, unfortunately, it's scary at times.
Exactly, it's those filters, and they want to copy the filter, and that's not the way to do it.
Paul, tell me a little bit about LASIK surgery.
So LASIK is an option where if you don't want to wear glasses, you don't want to wear contacts anymore, you can basically have a surgery where we have a specialist, an ophthalmologist, LASIK surgeon, reshape the surface of your eyes, and essentially you don't need glasses anymore. The way we recommend it is once your vision has been stable for a couple of years, and you're over 18 at least, I tend to go more closer to 25, just to be you want to be more stable, because if you do it before you're stable, whatever is going to change will still change after the surgery, so you won't end up with such a big prescription, but you still might have something. So that's why we recommend it later. So essentially, they reshape the surface of your eye, let's say they do it on a Friday, by Monday you're good. So recovery's pretty quick.
Okay.
You just have to be kind of cautious for the first couple of months, just to not rub the eye, not touch it, things like that, and use drops to get rid of the inflammation of the surgery. But you know, as far as I've had patients go through it, all of mine have had honestly perfect results so far.
Nice.
It lasts a good 20 years for most people plus.
Oh, do they do it again a second time, or at that point after 20 years they wear glasses?
Depends on the patient.
Okay.
There are some cases where they can do it.
Okay.
If it's because they need reading glasses after a certain point, no, they typically don't do the surgery. Although there are other surgeries to correct both distance and reading for patients that is not LASIK. They essentially implant a contact into the eye, behind the eye, and they see clearly. So that's another
Technology.
option. Yeah.
In 20 years, so much more will come.
Exactly. As we go further along, it's only both of those surgeries are only going to get better.
Okay. Well, I have not had an eye exam in, I don't know, God knows how many years. So I'm here, might as well, get my eyes checked.
Exactly. Good thing you're here. We can get that done right now for you. Not a
I'm walk out
problem.
with glasses.
Hopefully not. Okay, so we're going to start with a few pre-tests for Mike here. We do this one here, which is the famous puff of air. So this measures your eye pressure, screening your eye for glaucoma. And then next to it, we have that one. So that essentially measures the shape of your eye, and it gives me sort of an estimate of where your prescription might be if you have one. And then third, I'll do this one right here. So that one is a scan of his retina. So we'll see the back of his eye.
Wow.
Again, be able to screen for
Some of the three
Exactly.
exams. All right, let's do
three
this.
pre-tests here. Okay.
What do I do?
Have a seat right here, Mike. Let me actually clean everything off. I didn't.
I have a seat. Okay.
Sorry, I forgot to clean
No
it.
worries. No worries.
Okay. Cleaning soft for you.
Okay.
So it's been a while since your last exam then.
20 years, if not more.
Okay, let's see. Clean that one off as well. Okay. All right, Mike. Let's actually start on this one.
Okay.
Right here. Oh, no, right here.
All right. Okay.
Let me get to set a comfortable height. Okay, chin in there. So all you need to do, let me line you up. Okay. All you need to do here, Mike, you'll see a hot air balloon, with the road. Just stare at the hot air balloon.
It's blurry though.
That's normal. It'll
Oh.
kind of come in and out of focus for you. So this one I'm measuring the surface of your eye. Getting the shape of your eye. Same thing here on your left eye. So just look straight ahead again. Okay, all set there.
Okay.
And then let's do this one right next to it. So this is the puff of air. So you'll feel like a gentle puff of air, okay?
Okay.
Try to relax here. So like I said, we're gonna measure your eye pressure with this one. So look straight. You'll be a little startled. Yeah, look at that light right there, good. Let me get one more reading. Perfect. And then same thing with the left eye. Good. Okay. All set with that one, Mike? Okay. And then this one here. Switch on over to that chair. Let me just put your info in here real quick. Okay. And let's raise that a little for you.
Okay.
Okay, yeah, chin right in there, Mike. Is the height all right?
It's fine.
Okay. So you're gonna look straight ahead. You'll see your light in there, a green
I
light.
don't see anything.
One sec. It's gonna approach your eye.
Oh, okay.
There you go. So you'll get a flash of light in there in a moment here. So just look at that light in the middle. And we'll move on to your left eye next. Same thing. So this is inside Mike's right eye. So the first thing we typically assess is this structure right there. So that's the optic nerve, connects his eye to the brain, sends everything back there. Typically we're looking for glaucoma mainly, which he shows no signs of. And then next to it, so we have this dark area that's called the macula right here. That's the center of his vision, best part of the vision. We're looking for macular degeneration, which again he has no signs of. And then just kind of assessing his blood vessels right here, all these red veins and arteries, very healthy, very normal, looks good. And then likewise for his left eye here, his nerve looks great, very symmetrical to his right one. Macula as well looks healthy, and all the blood vessels look good. So healthy retina is there.
In other words, I see well.
Yes, we'll find out with the rest of it. Okay, you can sit back. All right, done with the pretest.
Yeah.
Okay. Let's head on into the room.
Okay.
Okay, our patient's seated right here. Mike's ready for his exam.
So
Let's take a look. Okay, Mike, let's see here. So far you did well on your pretest, so let's see how you do on the rest here.
All right.
Okay, let me clean this off too. So basically, we will do the full assessment of Mike's eyes, his vision, how he's seeing, as well as the health of his eyes a little further. So let's start with just checking his vision, seeing his visual acuities here. So here you go, Mike. Okay. Cover your left eye.
Left eye.
And let's see here. Let's put some letters up there. We can start smaller. Go ahead and read it.
VZERP.
Great.
BACDS. ERSDV. TPLAO.
And here.
ZHNBC.
Good. 20/20 on that right. Let's switch eyes.
All right. LGVHN.
And here.
AFDCB. EHVGO. CZSSA.
Okay. Got all but one. It's a B.
What's a B? Oh,
still, that was a 20/20 line. That's pretty good.
I there for a second. All right.
Okay, that's not bad. That's a really good start. Okay. So look at that K. So next, I'm just going to assess your eye alignment here. All you got to do is look at that letter K. I'm just going to cover your eyes here, Mike.
Ready?
Okay, yeah, just stare at the K for me. Okay, great. Yeah, his eyes are aligned. Okay. Let's check Mike's pupil responses here. So again, straight ahead, Mike. I'm just going to check your pupils here. Okay, good. Okay, so let's see. Let's work on the prescription here if there is any. So far, it doesn't look like we'll need anything, but let's make sure.
Looks good.
All right. Okay. Comfortable with the height there, Mike?
Yes, sir.
All right. Okay. Go ahead and read that real quick.
OGKZH.
Okay, what? I'm going to change the lens in there, Mike. Let me know which one you prefer. So that's 1, or do you prefer 2?
1.
Okay. Different pair here, Mike. 1, 2, or even?
Even.
Good. Okay, go ahead and read that.
PNRCA.
Perfect. Okay, looking at these, Mike. Both might be a little blurry. Let me know which one you like here better. 1, 2.
2.
Great, and then again, 1 now. Or 2.
1.
Okay, how about here? 1,
1.
2.
1.
Great. And 1, 2.
It looks the same to me.
Great. How about now? 1 right there.
This is good.
Or 2.
They're both good.
Okay. Let's keep it right there for you. Okay. Okay, let's take a look on your left. Go ahead.
NBSZC.
Okay, and what do you like there? 1 or 2?
Do that again?
That's 1.
Okay.
2.
1.
Great. Okay, read that.
TPZHC.
Okay. And here, Mike. 1, 2.
2.
Okay. And again, 1, 2.
1.
We'll call that 3 right there, or 4.
3.
Perfect. And here, Mike. 1, 2.
2. Okay, got it.
Okay. Same test for this side. Which one's better here?
The one in red. They both look equal.
Very good. Okay. And that should look good.
I can see now.
Okay, good. Yeah, honestly, you're good. Let's check the reading now.
Okay.
The reading portion. Are you able to read that very bottom line?
APEORFDZ.
Good. Okay, I'm going to move this card close to you, Mike. Let me know if that line you just read gets blurry at any point.
Okay. Nope.
Still good?
Now it's a little blurry. A little, not too much. I can still see it though.
Okay, good. All right, yeah, your vision's good. You might be the easiest patient I've seen in a while.
I'm good.
Yeah. Let's take one last look at your eyes with the microscope here, Mike.
Moment of truth. The moment of truth.
Okay.
Okay.
So, we can drop you down a little. Okay, Mike, so chin right in there. Okay. Look kind of towards my ear. So first thing I will be doing here is looking at the surface of your eye. Looking at the cornea, which is that clear part in front of the colored part of your eye, and that's healthy, no signs of any issues. No cataracts. You're thankfully too young for that, typically. Okay, look to your right. And then left. And up. Looking at the lids and lashes. Very healthy. Look down now. Okay. And then look towards my ear for me. Okay, it's going to get a little bright, so I'm going to look once more at the retina here with this. Good, yeah. Looks very healthy. Everything's normal. Blood vessels look great. Okay. Look towards this here, Mike. Let's see. Yeah, same goes for this side. The surface looks good. The cornea. No sign of any cataract here either. Look up. Down. Yeah, lids and lashes look good. Now to your right. And left. Perfect. Okay, look towards my ear once more. Again, it's going to get bright. Wonderful. Yeah, you're doing great, Mike.
Yeah? Nice.
Yeah.
Good.
There's honestly not much to say. Keep wearing your sunglasses. Keep eating healthy. And yeah,
Appreciate
we'll
that.
see you in a year.
Yeah, thank you. Paul, I appreciate your
Thank you.
time.
Thank
if
you
our
so much,
viewers want to reach out to you with questions, what's your contact? Where are you guys located?
So we're located in Santa Clarita. They can reach us through the phone, 661-288-2068 to set up appointments. As far as reaching us, they can go to our website.
Okay.
So it's drpaulvision.com. So drpaulvision.com. And same goes for the email. You'll see it on the website, but it's drpaulvision@gmail.com.
Thank you, Dr. Paul. Thank
Thank you, man.
This
Great.
was fun. I hope you guys enjoyed it, and I hope you guys learned a few key things how to keep your eyes safe. So
Thank you, Mike.
Paul.
Really appreciate you coming
Absolutely.
out. Thank you.